Cyberchondria is kind of a fun term and a very recent term, and it refers to people who go online in search of their medical diagnosis. They may feel some symptom in their body and start to get worried, and it's 3 in the morning and they can't call their doctor, and besides it would take forever to get in to see their doctor, so all of a sudden they go on one of the medical sites and start searching their symptoms. But the problem is, although perhaps if you're just feeling sluggish and a little nausea, that could be accounted for just by eating bad food or being under stress, a lot of people will jump to more serious disorders like, oh no, I might have carbon monoxide poisoning, or I might have kidney failure. So the problem is with cyberchondria is not that they might have some of the smaller things or consider them, they usually jump to something bigger. Most people who have cyberchondria, well, let's look at most people who go on the web. Most people who go on the web are searching all kinds of information, so it's not weird to look up health information. And Harris Interactive poll actually estimates that about 110 million people a year go on and search out health information, and some people do it up to 3 times a month. So it's a very common thing to do such a thing. But here's how you might know. You might know that if after looking on the web for your health information you feel worse after web surfing than better, then also if you check in with your doctor that his reassurances won't help you, and if you go quickly from suspicion, which is okay, thinking, might I have this? I'm going to ask my doctor about it, to conviction, where no one can convince you otherwise, and you think for sure that that black dot that everyone else thinks is a mole must be skin cancer. So if you go from suspicion to conviction very quickly and don't take your doctor's word for help, you might have cyberchondria. You know, cyberchondria might be just a light version of hypochondriasis. And hypochondriasis is a very real disorder. And we might look at hypochondriasis as an additional couple of things. One is that it causes a very significant stress in someone's life, and also that it lasts for 6 months or more. So if you to go online, you don't feel good, you don't take your doctor's reassurances, then you move to conviction quickly, it's been happening for 6 months or more, and it's very distressing to you, then you might have hypochondriasis. Cyberchondria might be just the subtext of what's going on. But we also want to rule out other things, because hypochondriasis or cyberchondria might just be a symptom of many of the anxiety disorders and sometimes depression. So you want to rule out things like generalized anxiety disorder and panic disorder. Are there treatments for this disorder? Absolutely, but the treatments for this disorder really mirror treating any other anxiety disorder. So it's going to be both, first you want to rule out, is this really a medical condition? And once the person is armed with that information, then the psychological aspect can be looked at. And we might want to look at all the different forms of anxiety that might be going on for the person, and why they're not believing other people, and what in fact are they avoiding. So a good treatment for this disorder might be a treatment called cognitive behavior therapy, to look at those thoughts that they're having about their body and why they're so convicted about it, and helping to expose them to those and helping them to deal with the emotions that come up and taking different actions. Hypochondriasis is hard to find information for. In cyberchondria, the articles are usually quite mocking. But there's kind of a fun and very informative and helpful website that was put up by somebody called The Hypochondriac. And so go to the www.thehypochondriac.com. That's www.thehypochondriac.com, because it actually walks through symptoms and treatments for hypochondriasis. And if you want to find more information about me, you can do so at www.drgreg.com.